Welcome back to Sawika Sickle Cell Awareness YouTube channel. Today's topic is what triggers sickle cell crisis. First, let's define what sickle cell disease is. Sickle cell disease is a hereditary problem that causes a type of faulty hemoglobin in red blood cells. Hemoglobin carries oxygen in the blood. Normal red blood cells are disc-shaped and very flexible. In sickle cell disease, some red blood cells can change shape so that they can look like a crescent or a sickle. Because of their shape, they don't move through the smallest blood vessels. This can stop or slow blood flow to parts of the body, causing less oxygen to reach these areas. Now let's define what crisis is. A sickle cell crisis is pain that can begin suddenly and last several hours to several days. It happens when sickled red blood cells block small blood vessels that carry blood to your bones. You might begin having pain in your back, legs, arms, chest, or stomach. This pain can be throbbing, sharp, dull, or stabbing. How often and how bad the pain gets varies from person to person and crisis to crisis. Let's list the top 12 triggers for crisis. The first trigger is stress. Stress in your life will cause your sickle cell to get bad or flare. I know when I was dealing with different governmental agencies like defects and dealing with getting the help I needed, dealing with medical professionals, I was constantly taking medication because I was constantly in pain, trying to express what I needed and to get what I needed from different government agencies and healthcare professionals. The second trigger is depression. Sometimes when you're dealing with sickle cell, you feel all alone. You don't feel like nobody's there. And you also are in a place where sometimes even when you're going through crisis or you're feeling bad, other people just don't understand. That's why we are building a stronger and a better community for sickle cell patients around the world. The third thing that triggers crisis is smoking. Because you're smoking, you're constantly losing oxygen in the body. So I recommend that you stop smoking. And even if you can't stop smoking, I hope and pray that you reduce the amount of smoking you do. Because the more you smoke, the more oxygen you lose. The fourth things that trigger crisis is alcohol. I'm not saying stop drinking alcohol because I drink alcohol myself on special occasions. When I don't feel like taking relaxation medicine, I will have me a small glass of wine or a small glass of Moscato. But after I get finished drinking my glass of wine, I will hydrate my body with water. Which leads me to number 5 trigger. Number 5 trigger is dehydration. A lot of sickle cell patients experience a lot of dehydration, and sometimes they are so dehydrated that they're hospitalized. My motto and my belief in life is water, 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 water. Which leads me to my number 6 thing. This is what sent me in the hospital in 2013, extreme exercise. I love exercise. Exercise is how I relieve stress. And in 2013, I began marathon training. So I was going from 6 laps around the track to increasing up to as far as 12 laps a day, 6 laps in the morning and 6 laps in the evening. But my pain was increasing and I began to take Tylenol. I got to a point where Tylenol wasn't working. So I ended up being hospitalized, and that's when I was diagnosed with sickle cell beta thalassemia. So I've reduced my exercise and now I just lightly walk because that's the only thing that won't send me into crisis. Extreme weather triggers crisis. This is the number one thing that most people say about sickle cell patients. Most sickle cell patients go through crisis because the weather changes. That's true. But as the weather changes, we prepare ourselves for the change of weather. Like we're in the winter season right now. I know I need to stay covered up. I know I need to stay warm. And then when the summer months come, I know I need to be somewhere near some air conditioning and make sure I drink plenty of water and stay hydrated. The eighth thing is infection. Most sickle cell patients don't realize this, but our immune system is very low. So you can't be around everything and everybody, and if you do, sometimes when you're around a lot of people, you easily pick up an infection. I'm guilty of that myself. I'm one of those people that like to visit my friends and family in the hospital, and sometimes they may have a virus or an infection or whatever the case may be, and I have to be very careful about that. And I have to sometimes send my love from a distance. I have to FaceTime them, Google Hangout them, or give them a call because I'm protecting myself from getting sick again. So that's another thing. We have to protect ourselves and make sure we take our vitamins and take our medication as prescribed for us to reduce different infections. Also, stay in contact with your CDC doctor. My CDC doctor is Dr. Franco. I love Dr. Franco, and he's good with it. Anytime an infection comes up, he's like the first person I contact. Number 9 is a lack of proper rest. And I know you're saying, how can I get proper rest if I'm in pain? When you're in pain, you're not going to get proper rest. But any moment that you realize you need rest and your body's going to let you know that you need rest, you need to get the proper rest and sleep. I know a lot of times when I'm not feeling the best, once I've gotten enough rest, then I'm back to my normal and usual self, especially if I'm doing a lot during the day. I'm doing a lot of running around, or I'm attending a lot of different events, and sometimes being at events I get tired and I have to come home and rest. Number 10 is other health issues. Because I have neuropathy, I'm in pain a lot too, because I have nerve damage in my feet. That's one of the things I have to deal with. And I also have congestive heart failure. So when my heart is not functioning properly and I'm dealing with the issues with my congestive heart failure, it also triggers my sickle cell and I go into crisis, which brings me back to I have to make sure I'm taking my heart medicine or I'm taking my Lasix to make sure I'm not retaining fluids on my heart, because it makes it even hard for my heart to pump. So you have to look at the different health issues. I know a lot of sickle cell patients end up having diabetes. So you have to learn how to manage having diabetes and having sickle cell all together. Just come up with a healthcare plan. Lifestyle makes the difference. Lifestyle makes a world of a difference. I've made a commitment to myself to at least once a week I need to eat raw vegetables. I eat raw vegetables. I go to Subway or I go to a farm. I have family members that own a farm, so I'll pick some raw vegetables out of their garden and eat that at least once a week to make sure, like kale, broccoli, spinach, and make sure I get the nutrients I need as well. The 11th thing that trigger crisis is traveling. I am a world-class traveler, but I tell you, traveling will trigger it because you're constantly on the move, you're constantly on the go, and I'm the type of person when I travel, I try to drink as less water as possible because I don't like using the bathroom on the bus, on the plane, on the train, in public places. I'm not big on using the bathroom, so sometimes I get dehydrated or I get tired, and sometimes I'm in a new place, so I'm excited. So, and after doing some touring or attending events or participating in events, I am very tired when I get home or while I'm on the trip. And when I'm on the trip, usually the group of people that I'm with, I'll tell them I need to go back to the hotel room and get me some rest because my body is tired or is aching. So that's another thing. Traveling triggers it. Pregnancy is also a trigger. Sometimes women, when they're pregnant, they develop pregnancy diabetes. So just recognize what's going on with your body and make sure you talk to your healthcare professional about your health, your pregnancy, and if you have sickle cell disease or if you have the sickle cell trait, make sure you let your doctor know that. Let them know that I'm a sickle cell patient, I'm having a baby, and what management program do you recommend, or what information I need to better care for myself and my child while I'm pregnant and while I'm being a mother or a parent. That is so important too. And the last thing that I'm going to talk about is some solutions. My top 3 solutions to pain management. My first solution is always a nice hot bubble bath. And before I prepare my bath, I always put Epsom salt all over the bottom of my tub. So I'll put the Epsom salt first, and then I'll start putting the water in, and then I'll put my lavender bubble bath in there. Bubble bath. So I'll let that sit there for a while and make sure I start off with hot water, and I'll let the hot water run, but I don't get into the tub until I can stand the hot. Once it kind of cooled down a little bit, then I nicely step in and I lay back and I sit in the tub for at least 30 minutes, and I have my iPad on playing some soft music, some beach music, or something to relax me and tranquilize me. That helps a lot. That's usually the first thing I resort to when I'm in pain or I'm aching or after a good workout. And then the second thing that is good for pain management is a deep tissue massage. For those who can't afford a massage, sometimes I'll get a close friend of mine, guy friend, or I'll get a family member to massage my back and my body wherever it is aching. My mom is usually one of my top priorities of getting when I need a body massage. And I have a younger sister that's a physical therapist, and when she's available, she'll do a deep tissue massage on me. That's very helpful. So I have people there that can do a deep tissue massage, but for those that don't have someone, there are some spas that do 30-minute massages for $30, which isn't bad. You deserve it. As a patient, you need that time for yourself, so I recommend it. But if it's not in your budget, figure something out. So, and my last thing is pain medication. Sometimes I know this is the first thing most people resort to, but I try to let pain medicine be the last thing I resort to. You can get pain medicine that's prescribed from your physician, primary care physician, your sickle cell physician, or you can get something over the counter to reduce the pain. So that was my first topic for this channel. This was the most important thing to me, because with this channel I also want to make aware preventive measures for some things. If I can talk about or help you prevent going into crisis, that's what I want to do. And if you have some more information on what triggers crisis, you can write something in the description box at the bottom, or you can inbox me at monica.rockwell@gmail.com. Don't forget to subscribe to my YouTube channel, and you can follow me on social media. You can follow me on Facebook, you can follow me on YouTube, and you can follow me on Twitter, and you can follow me on Instagram at suwiga.sicklecellawareness.com. Until then, bye-bye.